Good afternoon, guys. I hope we're all sparkly. The most commonly used word at the clinic is balance, followed by stability, followed by Rob. You need to understand that balance within the body can only be achieved through contrast. And actually, consciousness is the appreciation, the subjective appreciation of subtle changes in your physiology. Deep, eh? So, when you get worried, when you have the weight of the world on your shoulder, understand that you want to manipulate your physiology, not your psychology. Manipulating your physiology will cause an improvement in your psychology, because our psychology should be used for good, not harm. We are a society, a species that has depression and anxiety running through it as if it is normal. It is far from normal. You do not see anxious animals or depressed animals unless you take them out of their natural environment and stick them in a zoo, because that animal can no longer fulfill its destiny and its physiology. So let's go deep, if that wasn't deep enough. The most common word is balance, with an appreciation that you need contrast to establish balance. We talk about anabolic versus catabolic, sympathetic versus parasympathetic. The primary anabolic hormones are testosterone, estradiol, and DHT. Yes, estradiol, the female sex hormone, anabolic. You need it for muscle growth. You need it for joints, for mood, libido, cognitive function, cardiovascular health, fertility, all sorts of reasons. So we talk about this as if they're all working together. Testosterone, estradiol, and DHT. Now they are, but I'm going to give you an example here of the reason why we need to appreciate the importance of ratios in medicine and not tending to excess, which is our downfall most of the time. Breast tissue development. Boobies. We like boobies, but we don't like boobies on ourselves. Now, breast tissue development comes as a result of estradiol, prolactin, and IGF-1. The estradiol has an excitatory effect. It's an anabolic hormone. But in men, testosterone and DHT has an inhibitory effect. So they're all anabolic hormones, but the estradiol has an excitatory effect and the testosterone and DHT has an inhibitory effect. That is the reason, if you were a dude wanting to be a woman, they would block your androgens, testosterone and DHT, and give you estradiol to develop breasts, boobies. So it isn't as simple as saying, these are anabolic hormones, whack it in. The ratio is incredibly important. Now add into the mix sex hormone binding globulin, my favorite glycoprotein, which has a higher affinity for DHT than it does testosterone, then estradiol. Add this into the mix, it's another complexity. As we've already said, the body is incredibly complicated. The HPG axis relies on a negative feedback mechanism. There are positive feedback mechanisms. There's down regulation, there's up regulation. There are all sorts of regulations that go on within the body that we are completely unaware of. The body is incredibly complicated to make our lives incredibly simple. If we concentrated on physiology, not psychology, we would be far better off. We need to work with our physiology to improve our psychology. We need to actually have an understanding of physiology, an understanding that excess is excess. So if we understand the fact that we need a good ratio, and in this situation, anabolic hormones, testosterone to estradiol to DHT, then you understand the premise of stability, balance, harmony, and that's what we're trying to achieve. Again, as I said, consciousness relies on a subjective appreciation of subtle changes in our physiology. Deep. So, how do you work with your physiology? You need to understand it. Who understands it? We've all made mistakes, but hopefully now, with evolving science and a little bit of common sense, we can start working to a better future. Now, your androgens follow a diurnal pattern. Every day is a new day. Every day is an opportunity to start again. Your testosterone spikes in the morning because you've been producing testosterone overnight, repairing from the day to prepare for tomorrow. Why does it spike? It spikes alongside cortisol, the stress hormone, the catabolic hormone. So those two processes, anabolic and catabolic, are not independent. They actually need dependency for this. Waking up in the morning, having the drive, the determination, and energy and enthusiasm to get up. I don't want to get up at 6 o'clock in the morning to do HIIT, but I do. And I especially don't want to get up when I'm tired, but I do, because I know it's good for my physiology, which impacts my psychology. And in fact, when I really don't want to get up, and I still get up, and I get on that HIIT machine, and I do my HIIT, I actually feel better than when I wake up with some gusto, because I've conquered my demons. Despite wanting to press the snooze button, I've said, not today, mate. I'm going to get up. I'm going to exercise. I'm going to use that testosterone. I'm going to use that cortisol, because I don't like excess cortisol. Excess cortisol is normally produced as a result of psychological stress in our society, not a physical stress. If we go back to hunter-gatherer days, we weren't worried about keeping up with the Joneses, social media bullshit. We were hunting, gathering, living by our physiology, understanding our physiology. In fact, we didn't need to understand our physiology because it was by instinct, wasn't it? Much like every other animal on this planet, with a few exceptions perhaps, goes by instinct. Now, you don't see depression in animals unless you take them out of their environment and stick them in a frickin' zoo. So polar bears, lions, tigers trucking back and forwards. It is incredibly sad to see this, but it's because we've taken these base animals, removed them from their natural environment, and they can no longer fulfill their physiology. Not psychology, physiology. So we cause depression, we cause anxiety, and we cause anxiety and depression in ourselves, not understanding our physiology and living in a way that does not help us, it harms us. Too much psychological stress. This is not good. We need to be physically active in the morning. Not wake up, go to the fridge, start your metabolism. You need to earn that reward. You need to fight, struggle. You don't have to enjoy it. In actual, it's good if you don't enjoy it, because once you've done it and you've achieved it, the reward you get, the dopamine, the endorphins floating around your body, they're all the more worthwhile, aren't they? If something is too good to be true, if something is too easy, it isn't worth it. Now, humans turn to drugs. It is essentially the path of least resistance. We could talk about coke, pills, all that sort of stuff. But the worst drug is sugar. Refined sugar causes that high glucose, then an insulin spike, but you're essentially seeking dopamine. Get off the sugar, get off the booze, get off the naughty stuff. As much fun as it is, you haven't earned that dopamine, you haven't earned that serotonin, you haven't earned those endorphins. If you're drinking alcohol or you're taking opiates, you're dulling your consciousness, you have to understand that you have to pay the piper eventually. And everybody that's a boozer or druggie understands eventually you have to pay the piper. So an appreciation of physiology, an appreciation of the reward hormones will mean that you need to understand that these hormones need to be earned. You're not supposed to have high levels of reward hormones, because just for example, say if testosterone was a reward hormone and you're on testosterone replacement therapy, well, you wouldn't do anything, would you? That's retarded. So you want testosterone and cortisol in the morning to give you the motivation to get up off your bum, go exercise. Back in the day, hunt gather, but not in today's society, but to earn your reward. Then you can enjoy your reward, the food, and hopefully a bit of nookie. Nobody on their deathbed said, I wish I'd had less sex. Right, so yeah, earn your reward. That means physical exercise. Then eat, start the parasympathetic nervous system, then you can rest, then you can relax, and then you can fall asleep, because sleep is the primary time that you develop your testosterone. Get it? Working with nature, not against it. Earn it.